Hi, Dr. Tanya here, today with Tuesday's tips to keep your family healthy and safe. Today, we are talking about schools, but we're going to focus on why schools across the country are failing at opening safely and staying open safely. All we hear about and see in the media every day is this school had an outbreak, this camp had an outbreak, and we're only hearing about the schools that have had issues. Yet so many are doing things right and safely throughout the country. So today I want to focus on the ones that failed and why that happened. Because when I look at each case in the media, I think it's very clear, and I think we can learn from every single situation. And it's so unfortunate when there's an outbreak and kids and teachers and staff members get sick. But each situation can teach us more in terms of how to prevent transmission of COVID-19 as more schools across the country open, and also help us keep them open as the school year continues, because that's really what's most important. Anyone can open a school, but you need to keep it open in order for this to work out for everybody. So I'm Dr. Tanya Altman here today with Tuesday's tips. Please subscribe to my channel if you haven't and share this with friends. So looking at schools across the country and camps where we have seen outbreaks, let's start with some of their mistakes and also how we can fix this and do things better next time. So the first thing we've heard is that sometimes people test positive on the first day of school, the second day of school. Well, how does this happen if you test everybody before school starts? And we've talked about this before. This is why baseline testing is so important. And some schools have done baseline testing, yet they haven't obtained all the results before the kids and teachers have gone back. So in order to set foot on the campus, I am proposing that everybody has a negative COVID test within a week of starting school. Now, this doesn't mean that you're for sure going to be negative the first day, but it gives us an idea of the baseline level of COVID in our community, which is very important because many school communities have different levels of COVID-19 than the counties really close to them do. And so when you're looking at numbers, you might have a higher percentage in the county than you actually do at your own school. So by having this baseline level, it can help you determine, okay, are we okay to open school or should we wait? But you have to obtain all the tests and make sure everyone turns it in so you know the results. Okay, so that's the first step. The second step is making sure that nobody with symptoms and nobody exposed to COVID-19 actually enters campus the first day. So that means if you have been diagnosed with COVID-19 or anyone in your immediate household, do not pass go, do not step foot on campus, turn to online remote learning until your quarantine period is over. If you have any symptoms of illness, if anyone in your immediate family has symptoms of illness, cough, runny nose, aches and pains, diarrhea, fever, stay home. Opt for online remote learning. This is really important, especially for you parents, that you don't give your child medication and send them to school, because if there is an outbreak, the school is going to shut down, and we all have to do our part to help protect our community and our kids' classmates and our teachers. The teachers are the most important. They are the essential workers, and many of them are more at risk because they are older, they might have underlying health conditions, so we really need to do all of this to protect our teachers. So the next thing is wearing masks. So we know there's very good data that when teachers wear masks and kids wear masks, when everybody wears masks, it decreases transmission by 80%. When you combine that with distancing, you're over 90%. So that means teachers must wear masks and all kids in school must wear masks, even preschool age kids. This is really going to be key to decreasing transmission. So if you can't wear a mask, then maybe you need to opt for remote online learning until the numbers are low enough, or you can have a place where you are very well distanced from your classmates, because we want to have success the first month. That's really key. So we need to start off small with test groups, and then we can slowly phase and ramp it up as schools are successful and have no cases. So distancing is very important in the classroom, but also out of the classroom. So where do we see risk? Well, we've had teachers catch COVID-19 by being in a small room with other teachers, whether they're teaching remotely or they're eating lunch, so masks come off. And that's really the most high risk time when masks come off. So you want to make sure that at your school there are outdoor tents, there are auditoriums, places where teachers can go when they need a mask break. So they can sit 6 to 8 feet apart and eat lunch turned away from each other, because it's when they're in the same room that we see more transmission. And we know that adult to adult transmission is actually higher than child to child. And there's been many studies that show this. And even though there's been a few studies more recently that do show that kids can transmit, we know they can transmit. But we still feel that the greatest risk is from adult to adult and adult to child, more than child to child and child to adult. But it takes everybody working together to decrease transmission. So again, distancing is very important. When masks come off for water breaks or lunch breaks, you need to be far away from each other, ideally more than 6 feet. Let's try for 8 feet. So step away. There shouldn't be sharing of space. So we need to really focus on not only do kids have enough space on campus, but teachers too. And this is why hybrid approaches work well for so many schools, because you can't physically fit that many kids and teachers in a classroom. So if they alternate who's doing online remote learning and who's on campus, that is one way that you can actually space out everybody in the classroom more. And don't forget, for high-risk teachers, for school nurses, a face shield can offer another level of protection. When I'm in the office seeing sick kids, I feel very well protected with a mask and a face shield. And every child who's on campus is actually not going to be sick. They're not going to be symptomatic. We know they're going to be well because we're going to be screening them ahead of time. So the next thing that schools need to do is they need to have quick access to diagnose sick kids, isolate them, send them home, test them, and contact trace. So you want to make sure that your school has access to testing. Partner with a local pediatrician, partner with your public health department, partner with a local urgent care. You need to have a place where you can send kids and staff for testing. This is going to be key to making sure that you can stay open. You also need to have people at your school who can contact trace. There are plenty of free contact tracing courses online. It's not that hard to do. Many schools have had their nurses, some of their teachers, if they have a school physician, their head of security, all be contact tracers. And it's going to take a village of contact tracers. We can't rely on public health. They are very busy, and they're more important for the outside community, not necessarily for in your school. So when a child is sick, they need to be flagged, they need to go home. Somebody needs to call their pediatrician and say, hey, what is the diagnosis? Are they COVID negative? Can they return to school when they're 72 hours fever free? Or do we think they have COVID, or do they have COVID? And do they need to stay home for at least 10 days? And do we need to contact trace and send home all the students that sit within 6 feet of them? Or for younger kids who might be mixing and mingling, do we need to send home the entire pod? Now, again, by masking and distancing at school, we are essentially assuming that everybody has COVID-19, and we are accounting for that and protecting everybody. So testing and then sending people home is actually just another layer of protection. And we hope that many of those that we send home are actually going to test negative and only have to stay home for 7 to 10 days. And if they can get another test and they have no symptoms, they may be able to return sooner than their 14-day quarantine. But that depends upon the access of testing and tracing in your community. So again, this is all about communication. When you look at the California state guidelines, and I actually think they're very good, it includes frequent testing of teachers at baseline, and then every month or every other month surveillance testing, because this is important to make sure that COVID-19 is not creeping onto your campus, because we don't want it creeping onto campus, but we also want to do everything we can to decrease spread if it does get on campus, because it will. But the fewer cases you have on campus, the easier it will be to decrease the spread of those cases, and to, when they do pop up, to be able to squash them and put out the fire, so that way they don't continue to spread. I know this is a big task I'm asking everyone. I know it takes a lot of resources, and that's why we're really trying to get schools more resources across the country. This is so important. Unfortunately, we are seeing a huge discrepancy between what inner city schools are able to do and suburb schools are able to do. And this is not fair. I'm asking all of you to please step up and do your part to help your community. But also, by taking advantage of some of these smaller suburb schools who can come up with very clear guidance, who do have access to testing and contact tracing, we can actually learn from their models. And if they publish their data and show the rest of us what to do, that actually can be beneficial. So that way, as numbers decrease in some of the larger cities, we can open up schools in those cities. And it may not be today, but hopefully next month. And again, the most important thing that you can do to help ensure that schools in your area can open and stay open and do this safely is to get everybody in your community to wear masks, to distance, to wash their hands, and to make sure that they stay in touch with their doctor and have a good relationship with their doctor so they can get quick testing and results when needed. If the results don't come back for a week, that doesn't really help anyone. In fact, this is where rapid testing can actually come into place. If a child at school develops a fever or a teacher wakes up not feeling well, a rapid test can at least let us know, hey, you have COVID-19. We need you to stay home and isolate, and we need to quickly contact trace. Now, if a rapid antigen test is negative, that doesn't 100% rule out that you don't have COVID-19. You still must stay home and get a PCR test. But there are roles for all types of testing. And especially as we head into the school year and many schools across the country are already open, we need to embrace all types of testing and use them to our advantage. So I hope that helps today with a little bit of information on why some schools around the country are having outbreaks and failing, which is so unfortunate, but also to give you ideas for what your school can do to be successful, to protect the teachers, to protect the students, and to not only open safely, to stay open safely. Because education and community is so important for our kids. And it takes a village, but this is something that I do feel that we can do.